Hello everyone, welcome to Speaker Series with a Fulbrighter. My name is Aoife Tabassum. I'll be talking about my Fulbright journey pursuing a Master of Public Health degree at the Johns Hopkins School of Public Health. Now I'll start off with a quick outline of today's session. We'll start with a brief introduction about myself, my undergraduate degree, my reasons, motivations for pursuing the MPH. I'll walk you through about what the public health degree is about, and the various public health degrees, how many years each of those programs are, and of course we'll talk about the Master of Public Health degree at the Johns Hopkins School of Public Health. I'll also touch briefly on the various tracks or concentrations within the MPH degree, and of course some questions about potential careers after the degree. Just a quick disclaimer, the experiences are my own, and updated requirements might have changed from the time that I pursued my MPH. So do please visit the respective websites of the Schools of Public Health. Right, so let's begin. My undergraduate degree was in dentistry from the Army Medical College, where I was a NAST cadet. The Army Medical College has an amazing dental program, and there were two fields that I was particularly interested in during my undergraduate years. The first was oral and maxillofacial surgery, and the second was community dentistry. Community dentistry is a specialty within dentistry that examines the dental disease distribution at the community level, and looks at how to tackle sort of oral health and other diseases at the population level. Also, while I was in the oral and maxillofacial department, I saw quite a few presentations of oropharyngeal cancer. Now, this is the sixth most common cancer worldwide, but it's one of the most common ones in Pakistan, and the incidence is increasing at an alarming rate. So that really intrigued me, and I decided I wanted to study public health to understand interventions that were aimed at raising cancer awareness, early detections, early presentation, and cancer screening. I was also very much interested in the quantitative aspects of public health, like how many cases, where are the cases. So that's a little bit about my journey in deciding very early on during my undergraduate years that that it was public health that I wanted to pursue. And then while I was sort of looking at programs, I decided that I wanted to concentrate or sort of specialize within public health in epidemiology, and that came from my interest in cancer epidemiology and cancer registries. There's a very well maintained cancer registry by the National Cancer Institute. It's called the Surveillance Epidemiology, the SEER, the Surveillance Epidemiology and End Results. And it collects cancer statistics in order to understand the distribution of cancer and to reduce the cancer burden. So I was very, very intrigued by that, and there isn't a very sort of national level, very extensive cancer registry in Pakistan. So that was something that really interested me, and so that was my journey to public health. Now, what is public health? Public health is a science of protecting and improving health of people and communities through promotion of healthy lifestyles, understanding disease and injury prevention, and detecting, preventing, and responding to infectious disease. Now, the first question students may have when considering a public health degree is that, do you have to have an undergraduate degree in medicine or dentistry, perhaps, like in a very clinical field? Certainly not. The answer is no. Anyone who has an interest in improving health of people can, and there usually is a very diverse mix of people within the MPH class. Apart from doctors and dentists, there are students who have a nursing background, pharmacy background, even a veterinarian background, uh, allied health background, even economics and law background. So there really is no sort of hard and fast rule about who usually public health practitioners are, or which background they have. If you feel that when I was often within the interviews of Fulbright applicants, um, sometimes I saw that many of the applicants who chose and who stated that they wanted to pursue a public health degree, actually even said during the interviews would say during the interviews that they were perhaps choosing to pursue public health because they didn't have a choice or they didn't know what else to do. So that's just certainly a no. You absolutely want to make sure that your previous degree somehow matches with your desire to pursue public health, and you have to make an effective connection uh, between your between your previous degree and how it sort of culminated in your desire to the Johns Hopkins Bloomberg School of Public Health is located in the city of Baltimore, the state of Maryland. It's very close to DC and Virginia, just about an hour away from Washington, DC. And there's an airport within Baltimore as well. It's called the BWI airport. It takes just about 40 to 45 minutes by car and about an hour by train to get to DC. It was founded in 1916. They recently celebrated their centennial in 2016. It was named as the Johns Hopkins School of Hygiene and Public Health, and it was renamed to the Johns Hopkins Bloomberg School of Public Health in April 2001 in honor of Michael Bloomberg. Now, their motto is very powerful and really speaks of the very, very impressive and impactful research that happens within the School of Public Health. It's protecting health, saving lives, millions at a time. So, really speaks of the very, very far-reaching effects of the research that happens. So, just an example, our former dean at the Bloomberg School of Public Health, Dr. Alfred Sommer, actually did a research establishing the relationship between child mortality and vitamin A deficiency. And really, his research went on to show that children who were deficient in vitamin A had much higher mortality than children who were not. And so, vitamin A supplementation became one of the most cost effective interventions, of course, cost effective public health interventions of all time. Now, the Bloomberg School of Public Health is number one. It has been number one, ranked by the US News and World Report since 1994. And of course, it's the first and the largest school of public health. Um, Now, within the School of Public Health, there are a number of public health degrees. The first is, of course, the MPH, the Master of Public Health. There are other programs as well in public health, including the MSPH, the Master of Science in Public Health. It's a 2 year long degree and it involves practical experience as well. Um, the MHS, the Master of Health Science, focuses on a particular discipline of public health, and the MHA, the Master of Health Administration, focuses on the administrative side of health service delivery, and the Master of Bioethics, as its name suggests, of course, on the ethical aspects of public health. Now, there's all within the MPH and within some of the other programs as well. But if I'm going to speak in particular about the MPH, there's a practicum component as well, where over the course of a year, you're expected to spend at least 100 hours in a population level project, and it could be conducted at an organization or a public health agency, and it can be anywhere in the world. And so for example, you could also combine multiple experiences, or you could just do 100 hours in one experience. And so this really helps you develop the practical skills as well, that are going to, of course, enhance your employability once you graduate from the public health program. So really, you could, depending on your public health career goals, you could decide what you'd like to do for your practicum, or what, where you'd like to spend your practicum. So for example, my practicum, since my background was in epidemiology and biostatistics, so my practicum was at Action Against Hunger in New York, and ACF USA, and it was analyzing their data sets. So ACF USA also worked in Pakistan, and so I was very keenly interested on being part of a project that had some presence in Pakistan as well. So that's what I did, and that was my practicum experience. And then, so the capstone is basically, it's not exactly a thesis, but it's kind of like a paper that you have to develop from your so one paper that you develop at the end of your public health program. So there are a number of ways that you could do your capstone. So for your epidemiology and biostatistics, there's usually a paper required that showcases your statistical skills. So for example, a regression, be it a linear regression or a logistic regression, of some sort. So it could be multiple things. For example, you could do an evaluation of a project. You could develop a intervention. You could analyze an intervention to a particular lens. So it's really quite basically based on your career goals. So next, I just want to go through with the public health core disciplines: for health education, behavioral science, health services administration, biostatistics, epidemiology, and environmental health. So these are the 5 core disciplines of public health. And usually when you concentrate and you choose a particular track, since public health is such a vast field, it's very crucial that you narrow in and decide what particular aspect of public health you would want to really specialize in. So some of the public health career tracks, or some tracks within schools of public health usually, so I'm not talking about Bloomberg School of Public Health in particular in this slide, but I'll do that in the next slide. But for example, you could focus on public health nutrition, so sort of studying aspects of obesity, malnutrition. For example, maternal newborn health, you could look at outcomes in maternal newborn health interventions. For example, immunization, again similarly looking at vaccine uptake. I mean, all the more relevant in these days. Epidemiology, sort of disease distribution, where you find disease, what are the determinants of the disease, etc. International health and injury research are also very international health, of course, very broad field. Injury research, also a very exciting field. For example, road traffic accidents, interventions designed to reduce injury, etc. So these are some of the concentrations at the Bloomberg School of Public Health, specifically for the MPH degree: aging and public health, child and adolescent health, epi and biostats, which is what I did, food, nutrition and health, food systems, global environmental sustainability and health, humanitarian health, health leadership and management, health systems and policy, infectious disease, social and behavioral sciences and public health, and women's and reproductive health. So when you decide to concentrate in any of these fields, there's a particular course list that you have to ensure that you complete. Apart from, of course, the core courses which are common throughout the MPH program. So there are a couple of core courses that everyone has to take regardless. And then, of course, if you concentrate in one of these, there are some specific courses that you have to. Of course, there's some electives as well as part of those courses. And you, apart from the concentration courses as well, you also have the flexibility to choose, because you have to complete a number of credits, right, throughout the year. So you still, apart from taking the core courses of the MPH program, and the core courses of the concentration, and then the elective courses, for example, of the concentration, perhaps you still are left with flexibility to take other courses as well. And also, apart from that, you can also customize your MPH program. So there's also a customizable MPH program where you don't particularly concentrate in any of these, and you just you take a number of courses based on your interests, and you try to, maybe if you would like to get a flavor of everything. It's very exciting, because then there's so many courses that are offered, and there's so many interesting courses that it's often very difficult to decide what you want to take, and especially since it's a very accelerated program. So now, a very important question. All right, so once you complete your MPH, what are some of the careers that are open to you? This is certainly not an exhaustive list. These are just some of the possible careers that you can hope to pursue after your MPH, and I'm just gonna go through some of the very brief job description of each of these jobs. So the first is, of course, an epidemiologist, and they're usually employed at public health departments and pharmaceutical companies, and even research organizations. So basically, again, they monitor and evaluate this disease and its spread, and of course, with recent COVID, all the data analysis that you see about the spread of the COVID virus, etc. That's been done by an epidemiologist, and they usually just they're also involved with communicating to policymakers and the general public about the infection spread, etc. The second is the healthcare consultant. So you can always also freelance, and you can provide consultancy to a number of organizations, number of INGOs, research organizations, basically anybody who so just basically freelance consultant, etc., and or a contractual consultant, for example. And then the health informatics specialist. So again, it's a little similar to an epidemiologist, but it's a little more sort of quantitative oriented. This one is much more heavy on statistical protocols and looking at sort of I mean, you also have to have a good computer science, quantitative, etc. background, and biostatistics background as well. So you'll usually you'll use data. So you'll usually use stats and your quantitative background, computer coding skills, etc. to really analyze data and sort of yeah. So basically, you'll be involved with a number of, again, research organizations. So, and then the public health manager, public health project manager. Here you're going to be, of course, managing a public health project. For example, for an NGO, for a government agency, or for example, for an academic or a research institution, for example. Here is it's a lot of managerial tasks associated with this. So again, you're going to be looking at how the project is progressing, the staff, whether the project is on track, to completion. So lots of Gantt charts, project activities, etc. Then and then of course the healthcare researcher. Again, you could be hired by a research institution or by an organization, even an academic institution, for example, on a particular research study that they're doing. So, and then lastly, of course, the community medicine, or for example, in community dentistry. So, in an academic setting. So, yeah, you can teach medical and dental students, and yeah. So these are just some of the career prospects post MPH. But again, this is not an exhaustive list, and the sky's the limit, I guess. So yeah, thank you. And if you have any questions, just we can have a Q&A.